Oh goodness, last time I took my daughter to get her booster shots, there were waterworks. So I asked our insider, Dr. Scarlett Constant, for some advice. Listen up, parents, this will help. We're gonna start with tantrums, my favorite. So would you say it's pretty normal for kids to have tantrums?
Absolutely, it's a normal behavior. It's a normal developmental behavior.
So why do tantrums happen in young kids?
Tantrums typically happen when a child is having difficulty expressing their feelings, their wants, their desires, or the things that are upsetting them. And it's just their emotions are not fully developed yet, so their response is to throw a tantrum.
Okay, now what about, would you say it's normal for them to outgrow tantrums? Because we always hear the term terrible twos.
Right.
And is that a thing, or is that just something that parents say to make themselves feel better?
Right. Well, terrible twos are a real thing because between ages 2 and 3 is when the child starts to develop their verbal skills and they're able to express themselves a little bit more than they were before.
Right.
And so they know enough to know what's going on. They're able to tell you that they're upset by it, but they can't really articulate the way they should. So emotionally, they're still quite young. And so this is the time where they're trying to express themselves, but they don't really know how, and they throw a tantrum. Also, this is the time where they're pushing boundaries and they want to see how far they can push the boundaries with their parents.
So what's normal in a tantrum? Let's before we go a little further, are we talking throwing yourself on the floor crying, or are we talking throwing things? What are we talking about?
Hopefully not throwing things. A typical tantrum would, be crying out loud, expressing that they're upset, maybe throwing themselves on the ground, or attempting to hurt themselves but not truly hurt themselves. They try to hurt themselves to get our attention and to get our sympathy.
Right.
Usually when it really does hurt, they'll stop.
Right.
So usually trying to hurt themselves, it shouldn't include hitting the parent or hitting someone else, but they definitely want to do something that they know will hurt you.
Right. They're so smart.
They are so smart.
Now let's discuss what you specifically see in your office, because not all kids like going to the doctor. So are tantrums or outbursts something that you normally see in your waiting room?
Right. In the waiting room, usually things are quite calm. They're playing, they're with their parents, they're in their comfort zone. The tantrum usually comes when they're in the exam room and the physician enters the room.
Right. Oh, that looks familiar, yes. Yes. And then now, how do you ease their fear a little bit? We're going to get into that, but overall.
A lot of times what we try to do is, myself personally, I try to walk into the room, speak to the child. I explain to the child what I'm going to do in a step-by-step manner. I show them my stethoscope. I show them the otoscope. I sometimes even examine the parents first and show them that it doesn't hurt. Or if there's an older sibling in the room, I'll examine the older sibling first, and the older sibling will go along with me and smile and say that it feels good and it tickles. And then we try to calm them down. Another way is to let them hold my tools, because once they hold it and kind of just feel that it's something very innocent and nothing terrifying or taboo, then they calm down a little bit more.
Why do you think kids have such a fear of going to the doctor? I mean,
well, it's a very uncomfortable experience, I'll admit. Sometimes when we examine them, it hurts, or if we look into their ear, it tends to be tender and we can hurt them. They remember getting shots, which hurt. Sometimes they remember getting terrible, yucky medicine in the office that makes them upset. So there are a lot of bad memories at the doctor's office when you're typically sick.
Right.
The children that come in for well visits, a typical checkup, usually tend to be the children that are not very afraid. It's the ones that happen to be sick very often and have some intervention that they don't like.
Now, one of the big things that can cause tantrums is telling a child he or she needs a shot. I can't tell you. I went through this 2 weeks ago. This is why I'm saying I feel this show with my daughter and the flu shot.
Right.
And we didn't really tell her. She knew that she was getting a shot. We didn't tell her what day it's happening.
Okay.
So we show up.
Okay.
And she knows that I said, we're getting the flu shot. And
the anxiety began.
Oh, the throwing yourself on the floor, holding onto my leg,
Right.
because she remembered a past experience that she had.
Right.
And from the moment we got to the waiting room, into the room with the doctor,
she was upset.
She was upset.
Well, that was all anxiety provoked. She had a lot of anxiety about what was about to occur. And this is why I think the best thing to do is to discuss it with her in the morning before you go to the office. Discuss it in the car. Tell her exactly what to expect. And that way, yes, she might have a little more anxiety because now she knows it's coming, but it just desensitizes her a little bit more. Explain that. I also like, especially the older ones, explain to them why it's so important and why they're getting it and how it's going to protect them. And that way there isn't such a shock when you get there. Another thing with shots is that it's interesting. I read this not in a medical book at all, but in a parenting book years ago, that we tend to apologize to our children for shots or for anything that we do in the doctor's office that might be painful.
And we shouldn't.
And we shouldn't.
It's for their good.
Exactly. And so apologizing just confirms that what we did was with malice.
Right.
So we should explain to them and not apologize and say, we did this for your own good, and that way we can decrease some of this anxiety and tension and fear revolving around shots.
That's a great tip. Now we have some tips for parenting, for parents, for helping kids get through their getting the shot experience. So will you walk us through these, Dr.
Yes.
Constant?
Staying on schedule. This is a very interesting one because now with the vaccine fears and the fear of autism, a lot of families prefer to separate the vaccines and get on an alternate schedule, meaning their own vaccine schedule.
Right.
Which is fine, but this now causes you to come in for much more visits, much more frequently, many more shots, and that creates more anxiety and more tension and more fear about coming to the office. Now you're coming to the office almost always to get an injection, and that induces more
so that
fear and
inducing
anxiety.
More fear, right.
Smile, yes. So don't come in like you're the Grim Reaper.
Right.
So smile. This is a great experience, and it's an important experience. So another thing is the parents will come in and they're already stressed as well, and then it creates this stressful environment around the child because the parent looks afraid, then the child is afraid, and then it feels like there's something wrong going on.
I really talk up those stickers at the end.
Oh, yes.
Oh, yeah. So stickers and the lollipops, I really talk them
Absolutely.
up.
You did a great job. You know, you let the doctor give the shot. You were very brave, and here is your reward.
Right.
Distract your child, absolutely. We talk about other things. We get their mind off of it. Again, because a lot of this is just anxiety, anticipation. I can't tell you how many children are screaming and crying and have no idea that they already received the shot.
This happened to me, exactly the same situation. We were there, it was, give me back my leg. We get the shot, and as she's getting it, she looks at me and she says, well, that was silly, Mom. Yes, because she said it didn't even hurt. And it's the leading up, the anticipatory anxiety of it.
Exactly.
Wow. So in general, how should you prepare your kids for a doctor visit, whether you're getting a shot or not?
I think that, again, speaking about it the day before, the night before, telling them what's going to happen, speaking about it in the morning on your way there, showing them what typically is done in an exam. Almost every kid has a doctor tool set or a little doctor toy. Now Doc McStuffins.
I was going to say, she's been my hero.
She has. Many patients compare her to me, which is funny. But you just talk about Doc McStuffins and use your tools and show them. And that way when they get there, they're a little more comfortable. Let them examine you as a parent.
Absolutely.
And then when you get to the office, remind them again, and the doctor's going to come in and just kind of talk them through everything.
You know, I'm sure some of those tips could be useful for all you adults who are scared of getting shots yourself. Not naming names, but be sure to check out more from the interview on the Health Channel app.